Alright, so yesterday I did a video about the Degenerative Cascade, and I said today I was going to do a video about a patient that had some trouble with this that ended up in pretty bad shape. So I want to talk about that one today. So this is really about how a herniated disc, the degenerative cascade, and a failed fusion surgery led. So, sometimes we think back pain is just back pain, but it can be devastating. Absolutely devastating. So, story of our patient was, as a teenager, she fell down on the ice in a way that she sort of hurt her low back. And she had jammed her sacrum into her L5 vertebrae, and she had back pain. And she had back pain that would kind of come and go. So she'd kind of jam that disc. And then eventually what happened is the disc is like a jelly donut. And if you add excessive load to it or a trauma, kind of like what I had, is you can sort of knock a little bit of the pressure out of alignment and then overload a very specific portion of the annulus. So the nucleus was pushing out a little bit and it was aggravating her annulus. And she would have pain that would come and go every year. And she would get chiropractic treatment when the pain would get bad. And she would do some physical therapy, not with us, because this was probably 30 years ago. It would come and go. And every year she would get treatment and she'd feel better. She never really felt 100% better, but she would feel better. And then it was kind of getting worse as she got a little older. And it was part of this degenerative cascade that was happening. So she had the trauma when she was a teenager. She had the pain. She had the muscle spasms in her back, kind of holding on. Developed some altered reciprocal inhibition. And she sort of adapted to some of the muscle imbalances, which then ultimately start to cause a little shrinking around the capsule. And that shrinking around the capsule starts to stress the disc, and the disc under stress will develop the little tears. So it develops a little tear in the annulus, the nucleus pushes out a little further, but also at the same time you start to develop an increase in the inflammatory biomarkers. So she was getting more inflammation, in her discs as a result of the compressive load. So she was getting a breakdown, activities would make it worse, and the disc was degenerating. And then what would happen is every year this cycle would go on. And this is the degenerative cascade. So the initial injury gets worse over time, which is what was happening with her. It was progressively getting worse. So this loaded annulus was developing a tear, and over time she developed a bulge, and it got to the point where eventually the disc herniated. And when it herniated, she developed pain from the pinching of the nerve that was severe pain in the back and then severe pain down the leg. At that point in time, she was seeing the chiropractor and wasn't getting better, and was seeing the physical therapist and wasn't getting better. So they had consulted with a surgeon, and the surgeon thought that, all right, she was going to get the injections. So she did the injections, which is kind of the next level of therapy. So she did the injections and didn't get better. At that point in time, they decided to do a fusion. So what they did with her is they fused the bottom 3 vertebrae together. So they put screws in the pedicle and they hold it all together with some metal rods. So the ultimate goal of a fusion is to decrease any motion, but also free up the space where the nerve is. She got a little bit better for a couple of days, and then within 3 weeks the pain came back and it was more severe. So before the surgery her pain was about a 6. After the surgery her pain was an 8. And it was an 8 and it wasn't going away. And it was getting worse by the day. And so she had some more injections that didn't help. And then she started taking opioids. And the opioids, she'd been doing this for 2 years. Again, part of the whole cycle. She was taking the opioids for 2 years, and She was getting a little loopy, and she was getting very, very, very depressed. The longer you have chronic pain without any hope of getting better, you start to get depressed. And it got to the point where she wasn't sure if she could take it anymore. She'd had enough. There is a point where you have chronic pain that's so bad for so long, you have enough. So she thought deeply about suicide, thinking that was her only option. Attempted it. Survived. Came in to see us. We put her through the program. But during that 2-year time, she was continuing to aggravate the tissues post-surgery. So she had the failed surgery, and she was continuing to get worse. She again had a massive herniated disc, came in to see us. We started the 10-step process. Part of the degenerative cascade that she had, that the longer you have back pain, the longer you have it, which is what I had. If you've seen my MRI, the disc at L5 is very thin. It's because it's severely degenerated. And my pain was an 8 every day. So when you have that tear in the annulus, every time you move in specific positions, you aggravate it. And I've talked about this before. It's like having somebody cut your hand, and then we sew it back up to hold the skin together. What happens is you do this all day long. And when you do this, it doesn't heal. Matter of fact, the more you do this, the more repetitive stress on the tissue that's trying to heal, the more inflammation builds up, and it continues to build up. And you develop a supersensitivity. It's called central sensitization, where the pain is exponentially higher. So she had that. And the reason is C-reactive protein, interleukin 6, and prostaglandin E2. She had all these things happening. We started our 10-step process. The first step is to identify what's going on, which was the MRI, and then what we do is we give you nutrition to help decrease the inflammatory process. There have been some studies that identify that nutrition is better for decreasing this chronic inflammation than anti-inflammatories that are prescription grade. So she started the process. She started, this was 10 years ago, with the 11 super nutrients. And then we give her the tips and say, when you do these activities, you're making it worse. So you need to stop doing these activities. These are the 10 tips. People say, oh, 10 tips, are they that important? 10 tips are the most important to prevent the degenerative cascade, because the 10 tips are designed to help you so you don't aggravate the problem. How you sit, how you sleep, how you stand, how you do your everyday activities. There's a right way and a wrong way. If you've never been taught what the right way and the wrong way is, that's what the tips are. If you focus on the tips, you can make your life better. Okay? Again, the goal is to decrease the inflammatory process, start to get some healing in the disc. If you're doing this all day long, you're not going to get healing in the disc. So we put her through the program. Our program is specifically designed to decrease the herniated disc and get the blood to flow back into the disc. She went through the program. It took a long time. She slowly got better. These are not her MRIs. These are patients that went through the program. Okay? So eventually, it got to the point where her pain was gone. She had no more back pain. Period. She left our care, sent her on her way, focused on the tips, knows what good posture is, had no pain. She was no longer taking opioids. She was no longer taking the medicine for her depression. Okay? She was better. Living a healthier lifestyle. Not that she was unhealthy before, but she was no longer needing the medicine, doing natural supplements for the healing, emotionally feeling better. Pain was gone. The other day I saw her on the internet doing deadlift. This is 7 years after our therapy. Okay? She was doing the deadlift, no pain. So I messaged her. I said, that's probably not the greatest lift. She said, doesn't matter. 55 years old says, doesn't matter. Pain's gone. I got good form. You taught me what to do. Pain's not coming back. We were able to stop the degenerative cascade. When you bend wrong and you increase the inflammation, you make it worse. We had the ability to solve that problem. I mean, she was at the end of her rope. You don't get any further than suicide. That's the end of the rope. No more opioids. No more medicine, period. She's better. We were able to eliminate the process of all the degeneration. Still has the fusion, never took that out. Didn't need to. She got better through our program. We have the ability to solve it. But people say, do I need the nutrients? Yes. Do I need the tips? Yes. Very, very, very important. Okay? Here's the deal. Through our process and my 30 years of learning about back pain, okay, every single day, working on the best solutions for back pain. We've got studies published. Why do we have studies published? Because we have the ability to solve problems. And we work every day to solve more complicated problems. We get the most complicated patients better. You don't get any more complicated than this patient. Post-fusion, pain was innate, failed back surgery syndrome, emotionally a wreck, got better. You can get better. So I want you to like this video. I want you to subscribe to our channel. I want you to share this video. And I want you to add any comments. Been a little light on the comments because I've been super busy in one of the clinics, but I should catch up this week. That's it. I want you to call that number, make an appointment. And if you live too far away, you can call that number and we'll consult you over a Skype if you'd like. But the tips and the nutrients decrease the inflammatory process. The number one reason that surgery fails is, they did a study. And they said, why does surgery fail? Number one reason, too much inflammation. Interleukin 6, prostaglandin E2 at very high levels, they have found, I'm not saying you need surgery, but that is a variable as to why you don't get better. 11 super nutrients and the SPMs, specialized resolvents, decrease the inflammatory process. That's it. I'll go back to the numbers. You can find it and call us. Give us a call. We'll help you out. Have a good night. Be careful. Be safe. Stay out of trouble.